pathology report from the orchiectomy that was suspected testicular cancer that happened on May 13th came back a couple weeks ago. So I wanted to talk through this. The overall result was that the mass on my right testicle was not cancerous. It was a benign, non-malignant growth. So the recovery from the surgery in the few days after and the weeks after is going to follow this part of the video, but wanted to lead off with the results because this is a very rare case of a testicular solid mass. The way this presented was, had the orchiectomy, sent off to pathology report at the hospital where I had it done, and it was about a 2.5, almost 3-week wait until I heard from the urologist. And, that can be a really anxiety-inducing time. And I was trying just to not worry about it and put it in the back of my mind, but it was hanging there. It was giving me a lot of anxiety. I almost just felt like you were stuck in place, if that makes sense. So he called back and said, hey, good news. It appears that the mass in your right testicle from the path report was a benign growth. So the odds of that happening are pretty low. Most solid masses on testicles are one form of cancer, either seminoma or a mixed germ cell tumor, which is non-seminoma. And depending on how that presents, if it's invaded any of your lymphatics or any other parts of the testicle, you might have to have follow-up scans just on surveillance or some form of chemotherapy or abdominal surgery to remove the lymph nodes. So this is a very rare presentation, and my urologist had never seen one before. So to go through this, right, the pathological data, and when he called, he said, hey, this looks like a non-malignant, non-cancerous growth. We've never seen something like this. We're going to send it off for a second opinion. So they sent the path over to, I believe it was Indiana University, which is the best testicular cancer center in America. So then it was about another week from there until I got this full path report back from one of their pathologists. So essentially what this says is right testicle, spermatic cord from the orchiectomy. I had a benign testicular spindle cell fibroma growing. So the ultrasound marked it at 0.7 centimeters. But down here, I believe, there's an additional white tan firm nodule adjacent to the tunica albuginea that measures 0.8 by 0.6 by 0.3 centimeters. So that ultrasound the initial evaluation of 0.7 of a centimeter was pretty close. Typically, the growth will be a little bit bigger than what the ultrasound says, especially if it's invaded inward, but this was pretty much spot on. But the pathology report, right, negative for malignancy. 2 areas which contain a bland spindle cell proliferation adjacent, but not involving the testicle tissue. So it was in there, but not invading, and no malignancy was identified. The case was reviewed with another MD. So my progression of this went to have a vasectomy, and the little nodule was found sort of underneath the inside of it, and I'd missed it in all my self checks. I do those periodically, weekly. So really, everything looked normal here, and the spindle cell fibroma, by diagnostics, the only way to identify something like that is to be able to either do what's called a frozen section, to where you have your testicle removed essentially, and the tissue sampled and undergoing a pathology report there while you're under anesthesia. And if it is cancer, then they go on and perform the orchiectomy and remove it as standard treatment. But if it's non-cancerous, they can also replace your testicle. So after considering all of that, it would have delayed the process a while, and just given the percentages and odds that 90% of solid growths on testicles are cancerous, it was the right move to make. Initially, when hearing this, I thought, okay, well, I underwent this orchiectomy and had this taken out for no reason, but there was no clinical standard of care to leave this alone or to undergo the frozen section given the odds, right? And everything in healthcare is a risk and an odds, a risk assessment, essentially, which, given the percentages of cancer in solid growths, then it's the right standard procedure to just undergo the orchiectomy and get it get the pathology report and see what you're dealing with. So all of this, all at once, had the orchiectomy. It came out a non-cancerous growth, which leads me to this. And urologist had never seen anything like this before. He averages about 10 orchiectomies a year. So after we did some digging, this was the only actual case report literature review we could find on these spindle cell fibromas. And, they account for 2 to 5% of adult testicular tumors. This is what's classified as a sex-cord stromal tumor, right? So most of the tumors are benign, but a subsection of that, these are where the Leydig cell tumors, which is the most common non-malignant tumor, which is still only accounting for 2 to 5%, right? So of all tumors that we know in recorded medicine, 2 to 5% are non-cancerous. It's a very low odds as non-cancerous, right? But the testicular fibroma is a very rare one. So these fibromas resemble their ovarian counterparts. However, they are much less common than the ovarian fibromas. And to the best of this literature review, there have been less of 50 cases of these testicular fibromas reported in the English literature. So that means unless something was conducted after this study in 2021, I was the 51st case of this spindle cell fibroma in the testicle. So this is a rare case in this case study of a testicular fibroma, which is collagen plaque in a 51-year-old male presenting as a painless testicular mass, which is, I'm 35, just turned 35. I have never had any testicular pain, no symptoms of testicular cancer, normal size, no growth. I do periodic checks myself. I just missed this one because it was so small, sort of on the underside. So like I said, no pain, no symptoms that you would know, right? So this case study goes on to just in detail what these fibromas are. So this is one that's, I would assume it's fairly large. It doesn't have a measuring of it, so mine would have been even smaller than that. But these fibromas are basically just collagen in nature built up of a cellular structure, and they're entirely benign, but they are extremely rare. So this was my rarity, but very fortunate that it was non-cancerous and no follow-up treatments. I'll go back to the urologist every 6 months, or every year, November of this year, and then 1 year every year after that, just to check up. I am following. I'm going to get my testosterone levels checked again. They were low before the surgery, and I'd like to see that. But outside of that, in this recovery period, any symptoms I'm having are basically just fatigue, especially in the afternoon. But it's hard for me to know if that's just because I've basically been inactive for a month recovering from the surgery, or if there's something clinical there to follow. So we'll follow that up. But this was just a good example of the odds of it turning out to be non-cancerous are very low. I was very fortunate with that. But I cannot stress this enough. If you find a bump on your testicles, get it checked out immediately. There's such a stigma around men's health, and particularly how it relates to masculinity, right? So many stories out there of people saying, I found this, I started having a pain in my testicle, but I was too embarrassed to go to the doctor, or I'm the man and I can't afford to, whether that be financially, time-wise, or work obligations, family obligations, that I cannot afford to go take care of myself. And it is imperative, of the utmost importance, that if you find something like this, to get it checked out immediately, because the worst case scenario is you ignore it, and then you're coming down the clinical road of a future of chemotherapy, having to worry and stress for CT scans and checks to see if it's going to recur, playing the odds. If you get it addressed as soon as possible, even though the surgery it's scary, it's something to be concerned about, it's recoverable from. And best case scenario, if you do have a cancerous growth, is you have the testicle removed and there's no need for further follow-up other than taking a look at it and getting it checked every so often for blood tumors and CT scans. But the longer you let it go, it has a higher chance of metastasizing to your abdomen. And then you're looking at chemotherapy or having your stomach cut open with your lymph nodes removed in your retroperitoneum, which is a much more complicated, much more difficult surgery to recover from. And even worse, you can start developing pain, metastasize to your lungs, to your brain, and then you're looking at something that can have lasting impact for the rest of your life. So, despite, I won't mince words. This sucked. My previous video, I was very emotional from these worries of how this is going to resonate for the rest of my life, and I had the best case scenario, but this was extremely, extremely rare. 50 cases before me recorded in American medical literature. So very rare out of all the tumors. If you have a bump, please get it checked. Please take the appropriate actions. Get it addressed. There's no shame in it. There's no shame. So the rest of this video is going to be some videos I took immediately after surgery and in the days and the weeks following that, leading up to just trying to resume normal life. So if you have any questions, if you have a story to tell, if you just want somebody to talk to about this experience, please leave a comment, and I'll get back to you. Right, this was a lot of learning about the interventions and the treatments, and more importantly, the recovery from the surgery and having it done. In pre-op, I cried to the nurse just thinking about my life and my daughter, and it's really been my first time in my life of acknowledging and recognizing my mortality. So it's a disease that affects young men to where you're supposed to be in the prime of your life, and it can really kick you in the nuts, as they say. So there's a lot of people who have gone through this, good communities out there, good people to talk to that you can connect with. So like I say, if you're interested, the rest of this video is just the initial moments after surgery, getting back in the car, leading up to the days after, walking, talking about how it's feeling, showing the scar, things like that. So please comment, if you have any questions, just want to talk about it. Love to hear from you. All right, back in the car after right orchiectomy, or as I like to put it, getting your right nut shoved up through your stomach. So
you feel, you're feeling pretty bad.
No, I'm awake. The only pain I'm currently having is if I try to lift my right leg or use my abdominal muscles. So,
you're not nauseated or anything?
No. So it seemed to have gone well. The killer part now is going to be the wait on pathology. So we're going to go home and chill out a bit.
That sounds good to me.
And
gotta be
see my daughter.
About all them climbing on you and stuff.
This is my dad.
Who are you talking to?
I'm just recording this to make a little documentary series for others to what to expect. Surgery, right?
Right.
I went into the pre-surgery room. I was pretty scared to the point of even crying a bit on the nurse in there. She was very nice. The doctor, shout out, Dr. Spencer Hill, Dayton, Ohio, he did the surgery. He is a really cool dude. It went smooth. I think I was back in the OR for like almost an hour, less than an hour. He was able to spare my ilioinguinal ilioinguinal nerve, which is the nerve that controls sensation to the side of your abdomen where the incision is made. So a lot of people can report numbness from these surgeries, and that's likely why there can just be some ilioinguinal damage. But woke up, I never had anesthesia before, so I was woo. I think I was talking the nurses' heads off. But yeah, we're back to being cognizant. Got up out of the bed. Make sure you know how to do a log roll technique, which is bringing your legs and your shoulders over at the same time to get out of bed. That way you're not using your abdominal muscles to flex and stand up. So we got in the wheelchair, got pain medicine prescribed. We'll see how the pain evolves here over the next few hours, but going home to see my daughter. So I don't have a right nut anymore. Home for, I don't know how long I've been home, like 5 hours. Laying on the couch. The pain is pretty considerable, but this is the best way to do this. If you're laying down, Do the log roll. Use your side you didn't have surgery to support your leg. And push up. Also see if your head gets light, if you're orthostatic. But you got me, honey? Mm-hmm. We're gonna, what's bothering me is that it's hard to stand up straight at first. It just feels like a real pulling pain. But as we get moving here, just hang right there and we'll do a couple laps. Hi, baby girl.
So earlier in the show, we mentioned the non-international.
It kind of loosens up as you start to stand and walk a little bit better. So, this is the plan. Rest, eat, hang with my daughter and my beautiful wife, have some dinner, and hopefully sleep tonight.
What about this one?
What?
Winnie.
Not that one. She'll likely trip you. So, if you're going through this, it's going to be okay. Just make sure you're getting up, moving around a bit. It's going to be okay. We are about 24 hours out from the orchiectomy. So I want to walk around a little bit, trying to get up more. Not having any bruising or swelling, actually, but still anything using my ab muscles or lifting my right leg up causes a good amount of pain. The only way I can describe it really is as if it feels like you get kicked in the balls really hard, and then it kind of like irradiates up into your stomach. So still walking with a bit of a limp just because it's hard to swing my right leg forward like with a normal step, especially after you've been sitting or laying down for a while. But it's starting to loosen up a bit as you walk. So just taking the pain medicine, resting, getting up every hour and a half to walk. Dude, go behind the car. It's definitely challenging. I don't think I'm having it as bad as other people, it sounds like. One thing definitely, people complain about numbness in the area, especially where the incision is, sort of right on the front of your stomach. And something to keep in mind with this surgery too is to get the testicle out, they have to move around through your inguinal canal. And there is a sensory nerve that runs through there called your ilioinguinal nerve. And a lot of times, depending, on the size of the testicle after the tumor or surgeon technique, that nerve can get damaged and cause some more of the numbness there. The numbness in that area is pretty much faded for me by now, but I specifically asked, hey, if at all possible, be aware of that nerve, Mr. Surgeon. I would appreciate it. And he's awesome. Yeah, he was like, hey, no big deal. We salvaged that. I was just able to go right around it. So the numbness near my pubic area and like front of my stomach has pretty much gone away now. The incision is still a little puffy, which it's going to be. They inject numbing agent in there, so there's going to be some leftover swelling. But yeah, we're 24 hours out. I'm staying up on the pain medicine. Definitely helps a little bit. It doesn't take it all away, but I can tell a difference. It goes from, about a 7, 8 out of 10 to 4 or 5. So 24 hours in, waiting on the pathology report, being anxious about that. I think that's the worst thing on my mind right now, is not recovering from the surgery, but seeing the pathology report. It's now Thursday, coming up on the weekend, and next week is Memorial Day weekend, so I really hope that we can get that in. Other than that, just wanting to recover. I can't pick my daughter up, can't really do any lifting or bending over or anything, so that sucks. We're just trying to soldier through here, keep on going. So this has been update. Check it back. You're allowed to take a shower about 24 hours after. So once I do that, probably this afternoon, I'll show the incision a little bit and talk that through. So finally getting to take a shower after in the afternoon of, we were about 36 hours out now. So definitely still feeling some of the pain, and this is what the incision ended up looking like. We're not too swollen or bruised, surprisingly, but up and walking again, it's it's kind of rough after you're laying down and sitting down to get up and get going. Just feel like I'm hunched over a lot, just because there's like this big pulling sensation from here on my stomach all the way down to where the testicle was removed. But then after a while standing up, I'll get up, and then from that hunched over position, just stand upright, and it starts to feel a little loose. And then when you go back to sit back down, it's the same type of pain over and over. And I can't even really describe it. It's like, really, if you got hit in the nuts really hard, just repeatedly. So the incision looks really good. It's not, well, it doesn't look good, but at least it's not terrible. It's not terribly large either, which hopefully is a good sign that my testicle wasn't enormous with any larger growths, and it was pretty close to the ultrasound. So coming up on the end of the day too, my mom just made me an awesome tuna sandwich with like red onions and jalapenos and ranch. Appetite's been fine, haven't been nauseous, just the, oh my God, the energy's a little low, the pain. So yeah, we're hoping to hear tomorrow morning. It's gonna be 48 hours. Just waiting on the pathology report now, man. It's anxious, makes me very anxious, very nerve-wracking. So tomorrow's Friday. I'd love to get it for the weekend and know what we're looking at, but just gonna try to enjoy tomorrow and recover. My daughter's running around playing with my parents. It's awesome. But one thing I definitely noticed here is before this surgery, I had some visible abs going on, and now we're pretty puffy with some lower abdominal swelling. It feels like I can't really, even contract my ab muscles to lift my leg up or move up off the couch out of bed. So part of that probably just comes with the numbing process, but they also did tell me they put a numbing agent in the incision there in my lower abdomen to keep it kind of pain under control when I first woke up. So doctor did say also that the incision was going to be puffy and swollen for probably a few months just because of that. So hopefully we, weighed in at 179 pounds before surgery, which is the about the lightest I've been since did that longer fat loss phase 2 years ago. So coming around in at 6 foot, 178, I'll take it. But yeah, the body composition and the weight might be the least of the worries in the future. Hope not. So we're gonna do this, try to sleep a little bit better tonight. Had to sleep downstairs on the couch. My wife got to sleep upstairs. So I like to sleep back in bed. But one thing that really bothers me is like I'm laying flat on my back because I'm a little afraid to roll to the side and get my scrotum between my legs. So I'm gonna try to roll up some pillows, put them between my knees, and like roll over on the side to get a little more comfortable. So yeah, I'm gonna hop in the shower, and while we're there, check the remaining one again. Make sure you keep doing self-exams. I've actually not seen what it looks like or feels like since I came home. Just had the jock strap on the whole time. I've been a little timid to take a look, so this will be the first time. Hope it's not too freaky. And yeah, see you tomorrow. All right, we have survived the first 48 hours after the orchiectomy. We're into day 3 right now, so getting out of the house here, walking down the street some more. Pain is still there today. It's getting better. I actually slept a little bit last night. Was able to get comfortable. Big tip: roll up a thicker pillow, put it between your legs, especially if you're tired of laying on your back. I was just like really protective of not wanting to roll over and have my remaining testicle in between my legs. So that was good. Felt better, able to stand up a little bit more. So still on the pain meds though. It can be gnarly after sitting down. Some things, right? Finally took a shower. It was really weird. I hadn't really thought about not having one until then. Took the gauze off and actually saw it. So yeah, it was really weird. Just kind of had this moment after that, like, is this really my body? I'm trying to remind myself that I'm still me, right? Even with one testicle left, it's still me. And a common question, especially I had one of the same concern. Hey, get a testicle removed, am I still going to have normal sexual function? My wife was leaving for work this morning, had a really cute dress on. She looked great and starting to feel a little something. So we're still alive there. Might just take some time, and if you're feeling like, hey, it's not there, definitely talk to your doctor. Maybe look at testosterone levels. But yeah, coming up on day 3 tomorrow morning. This will probably be the last that I record here until the pathology report comes back. It's Friday now at like 3 p.m. So it's looking like we're going to be over the weekend before we get it. So that of course has some anxiety comes along with it. Trying to just be in the moment and think just one step at a time, right? The first step is over. And now it's going to be up to waiting and see what the next step is. I'm hoping for the best possible outcome, pathology report wise, but regardless what it is, we're going to take it one step at a time. So the plan over the weekend here, I just going to try to keep recovering, be up on my feet, walking, doing as much as I can. The thing that sucks is it's not really going to be able to lift anything. Like I can't really even lift my daughter up, and she's like 20 pounds. Just because you don't want to throw a hematoma down there, then you would be in even more pain and it would take longer to recover. Also, never worn a jock strap before. It's kind of weird. I didn't even realize that there wasn't a cover on your butt until last night when I was taking them off. I was like, oh, my butt cheeks are just out. So feeling puffy, right? Like I was dieting before all this happened, and now I'm kind of holding on to water retention and stuff. So I feel like my weight has probably shot up 5-6 pounds, but that's normal. So yeah, it's kind of a cooler day here. Just gonna hang out with my wife. She comes home from work, and our little kids running around, being funny, being crazy. My parents are with her, watching her, but definitely makes things harder when I'm just not able to, physically pick her up and handle her and carry her up and down the steps, get up off the floor bed with her, things like that. So yeah, if you're going through this process, drop me a comment. Let me know how you feel. So we'll check back next week, or when the pathology report comes in, if it happens to tonight or tomorrow on a Saturday. So I'm just going to keep trying to get better, keep moving forward here. So this was a video I took just looking at my physique the day before the surgery. I had been dieting for the summer and just feeling great. So I wanted to kind of compare what happened from then after. So definitely had a lot of lower abdominal swelling that I still have to this day that definitely makes me look a lot more watery. And we've gained a lot more weight, fat tissue here over the last month and a half or so since the surgery, just being unable to exercise and be as active as before. But, you can definitely expect, if you're in good shape and going into the surgery, that you'll have some ground to make back once you come out the other side of it. So one of the best tips, though, is definitely try to get up more frequently and walk as much as you can. I had some trouble lifting my right leg up or doing anything that involved using my abdominal muscles or my right hip flexor on the side, just because they go through that inguinal canal and have to, kind of work around some of your lower abdominal tissue. But you're not supposed to be getting back to any heavy lifting. They'll tell you don't lift anything over 10, 20 pounds. But the key is they don't really want you bracing and doing a Valsalva maneuver where you're holding your breath and really straining, even as far as pooping goes. So have some laxatives on hand and be careful here. So first time I went back to the gym here, I was just, it was about 2.5 weeks after the surgery, and I was feeling better, walking a lot, not having much pain at all. And I was getting a little crazy of not exercising. So just did some light movements that were not going to be heavy bracing, no real heavy back squatting or anything. So just went back to a hack squat machine, making sure to breathe all the way through, not really bracing down, pushing on your abdominal muscles very much. It's definitely still it feels a little strange in my groin area, just having to reposition things, but It's getting better. It's starting to feel like you're getting used to it. I definitely wore more supportive underwear for the first couple of weeks as walking around felt weird, almost like it's kind of hard to explain, but just like you're uneven almost, which logically that doesn't happen, but just strange sensations. That's gotten better too. Your body will acclimate to it over time, just as it would with anything. So, walking's your best friend. Just being up and being active, and not laying down for too long, not sitting for too long. And yeah, it's going okay now. This was a few weeks ago, and we're still trying to put our gym together and do that. So it's taking a priority over my exercising, and it's kind of been nice just taking it easier a little bit. But I'm back to the point where I feel like I could push things hard now, being a month out, if I really wanted to, and we will over the coming weeks. But other recovery tips. Try to have as much of a normal diet as you can, and by normal I mean just focusing on eating some good foods. I had a couple days there after the surgery where I just kind of threw caution to the wind, said, "Ah, screw it, let's have some pizza and some more fattier Thai foods and all." And after a day of that, I realized it was just making me feel like crap, especially sitting around. So try to get back to your quote unquote normal, which is as close as you can. You can see me there trying to adjust things, sitting in a leg extension machine that felt kind of weird. But other than that, it's awesome to have a good support system. My wife is awesome. My parents were around to help with our daughter, but not listening to my daughter for the first week and a half or so was sucky. She's made things harder on everyone else, but you'll get back to doing that too. Other recovery tips, right? You'll probably still have some numbness, sensation loss in the area around the incision. I still do now, about about 5 weeks out. Might even have some burning nerve pain sensations coming back, but just know that's all normal. And if you feel like you need to, reach out to your doctor. But keep an eye on how you feel and be kind to yourself. You'll recover and you're going through. So let me know how it's going.